ultrasound elastography for imaging breast cancer. In this presentation, first we have introduction. In there we will talk about some breast cancer statistics in Canada. After that we will see some imaging modalities to diagnose breast cancer. From there we'll talk about the core of this technique, which is elastography, and then we will see the objectives of this research. In theory and method, we will talk about the strain imaging and its drawbacks. One of its drawbacks is that it doesn't take into account stress variability. But in this technique, we do take into account the stress variability within tissue. And we came up with a high efficient technique to find the stress distribution within tissue. In the elastography technique that I'm aware of, images provide relative tissue stiffness values. But in the proposed technique, we do consider the stress variability within tissue, and for this purpose we design a force data acquisition unit that I'm going to describe in this presentation. After that, to see the feasibility of this, the proposed technique, we conduct some phantom study and in silico phantom study to see to investigate the impact of one of the ultrasound limitation, which is the limited field of view, and we see we assess the accuracy of geometry approximation and reconstruction values. And also to validate our proposed technique, we initially conduct another in silico phantom study, and to further validate our method, we conduct 2 tissue mimicking phantom studies. And then we close this presentation with results and conclusions. Breast cancer is the second most commonly diagnosed cancer among Canadian women, and it accounts for over a quarter of new cancer cases and 15% of death from all kinds of cancers in Canada. Early detection of breast cancer can play an important role in choosing successful treatment, and also can increase the survival rate of breast cancer. As such, developing techniques to diagnose and detect breast cancer can have a great impact on health of breast cancer patients. Previous research found that up to 60% of patients with breast cancer had multifocal one. Therefore, these statistics indicate that the high prevalence of multifocal breast cancer and the importance of dealing with it, and it should be tackled effectively. Therefore, the proposed system that I'm going to talk about is capable of dealing with multifocal breast cancer as well. Here we see some screening and diagnostic technique for detecting breast cancer. Breast self-examination is an examination that women herself look for abnormalities in her breast, and researchers found that it has limited effectiveness in reducing mortality rates. Clinical breast self-examination is a physical examination performed by a health professional, and on average women at age 40 and younger are more likely to have palpable breast cancer detected by CBE. X-ray mammography is an imaging modality that can be used for both screening and diagnostic purposes, and it uses ionizing radiation to create image. And as you can see here, this is an X-ray mammography image. This is the normal breast tissue, and this is the cancerous tissue. But X-ray mammography has low sensitivity in detecting breast cancer in women with at younger age with dense breast. On the other hand, magnetic resonance imaging, which this is an image of breast using magnetic resonance imaging, it has more sensitivity than X-ray mammography, but on the other hand, it has low specificity. And despite the fact that there is increasing interest in using magnetic resonance imaging for detecting breast cancer in women with high risk of breast cancer, but it is expensive and not widely available. Ultrasound is a portable non-invasive, real-time, and relatively inexpensive imaging modality. But on the other hand, its poor quality image reduces its efficacy in detecting breast cancer. And this is an ultrasound image of breast. We have seen in this slide that other modalities suffer from low sensitivity, low specificity, ionizing radiation, high cost, and poor image quality. As an attempt to address the drawbacks of these conventional ultrasound, these conventional techniques to diagnose breast cancer, we have developed an ultrasound-based elastography technique which turns out to be promising. The basic idea behind elastography is the fact that generally pathological changes are correlated with changes in tissue stiffness, and elastography conveys new information about tissue internal structure, and many cancers, such as breast cancer, appear as stiff nodules. This is the most primitive type of elastography, which is called strain imaging, and as you could see here, the blue area corresponds to the stiffer area. In this research, we use a full inversion approach, which is cost-effective and is capable of imaging the unifocal and multifocal breast cancer in a real-time fashion and accurately. And it also can be applicable in clinical breast cancer assessment. This study involves two in silico phantom study. One of them will investigate the impacts of geometry approximation to find a stress distribution within tissue on de Young's modulus values. The other study, in silico study, we have conducted to validate the proposed system. And also we have conducted two tissue mimicking phantom studies, and we have done some system development in order to make the system more user-friendly and applicable in real-time application. In this part, I'm going to talk about the theoretical and methodological aspect of the proposed system. In here, I will describe about the elastography in general term, which is the core of our system. As I said before, the basic idea behind elastography is the fact that pathological changes are correlated with changes in tissue stiffness. Therefore, in 1990s, Ophir had described a non-invasive imaging technique called elastography, in which he applied compression over the tissue region of interest, and it will be seen that tumor area deforms less than the surrounding tissues. Using these two sets of images, the pre-compression state image and also post-compression state image after applying compression, by comparing them, we can find the deformation pattern within tissue, and from there we will be able to find the elasticity distribution within tissue. Hence, in this technique, we want to find the tissue stiffness values based on its measured deformation pattern. It can be demonstrated that it can be formulated as an inverse problem, and forward and inverse problem will be discussed in the next slide. In forward problem, the structure of the system or physical object is known, and we want to acquire the output of the system as a result of an initial condition. For example, in tissue mechanical properties, the elasticity of the tissue is known, and we want to find the displacement field as resulting from applying a specific kind of loading and boundary condition. Unlike forward problem, in inverse problem framework, the input and output are known, and this one seeks to find the structure of the system or physical object. For example, in elasticity imaging model application, the elasticity distribution of the tissue is unknown, and by having the displacement field as a result of applying a given load, we want to find the elasticity property of the tissue. One of the primitive type of elastography is strain imaging, and in strain imaging, we assume that heterogeneous medium has a stress uniformity within it, and therefore the elasticity ratio can be calculated as according to this equation, which is the reciprocal of the strain ratio. And as you can see here, this technique is not capable of imaging the absolute Young's modulus value. And this is a strain image, as you could see here. And the red areas here correspond to the stiffer area. However, assuming a stress uniformity within tissue is a crude assumption, since the stress concentration occur near the boundaries of stiffer area. And in our novel method, we do consider we do incorporate the actual stress values within the reconstruction process using Hooke's law. Now we want to see how we calculate the stress distribution within tissue. We give the geometry, boundary condition, and loading to a software package such as Abacus, and it performs finite element analysis, and it will give us the stress distribution within tissue. However, for a typical sample like this, it will take 12 seconds to obtain finite element results. Now we want to know, is this enough for us? Can we do the reconstruction in just one step? And the answer is no, because for the reconstruction, we also need to have the Young's modulus value, which we are yet to have, and we want to obtain the Young's modulus value. Therefore, with